Hi, everyone. I'm Michelle Jacobs. I'm a genetic counselor with the Cancer Genetics Clinic at the University of Michigan, and we'll be talking to you about genetic testing in oncology. Just as an introduction to genetic counselors, patients can be referred to a genetic counselor to talk about their personal and or family history and what that information might say about their genetic risks for certain diseases. This referral and appointment can happen before or after they have genetic testing. Genetic counselors are not medical doctors, but are part of the healthcare team and work with both patients and providers to help them understand a few different items, including what a patient's genetic risks are based on their personal and or family history, their risk of certain diseases or cancer based on genetic findings, whether genetic testing is something that makes sense for them, and what the results of a genetic test may mean for that patient and their family members. Genetic counselors can also provide support as patients make decisions about pursuing genetic testing and can provide them with information about different conditions and different genetic testing options to help them make a decision that makes sense and fits in with their overall views on healthcare and their values. In a cancer genetic counseling session specifically, we will collect information about a person's medical history as well as their family history. We usually get information about 3 generations of relatives and focus this on cancer indications, so cancers, tumors, potentially some precancerous findings like colon polyps. Once we have that information, we use that to explain different genetic testing options and the details of those options in the context of that person's history. Talk about risks, benefits, and limitations of genetic testing. And then if patients want to move forward, coordinate genetic testing for them, most often using a blood or a saliva sample. These results usually take about 3 weeks, although there are some situations where that timeline may vary based on the specific test ordered or other factors. I mentioned that sometimes genetic counselors meet with patients who have already had genetic testing completed. So in that case, or if there's a known genetic diagnosis already, a genetic counselor can talk about what testing was completed, explain what those results mean for the patient and their family members, and figure out next steps with them.